Hi everyone and welcome back. I just want to make sure to remind everyone that we are going to be recording the rest of this conference today and that all of the archive materials and presentation slides will be available on our website for the conference. So next I'd like to introduce our third presentation for the day, Melanie Barwick. Melanie is a senior scientist in the Child Evaluative Services Program and head of the Child and Youth Mental Health Research Unit in the Department of Psychiatry at the Hospital for Sick Children. Dr. Barwick is an internationally recognized expert in implementation science and knowledge translation and has a program of research that spans health, mental health, education, and global health sectors. Her research aims to improve the implementation of evidence into practice and to broaden the research of evidence more generally to support decision-making, policy, knowledge, and awareness. Melanie, are you ready to begin?
I am. Thank you, Stephen. Can you hear me okay?
We can. Go right ahead.
Wonderful. Okay. Well, welcome, everybody. This might be the second or third time you've heard me on this conference, not this year, but in past years. And this year I want to, I've been invited to focus specifically on the evaluation of a knowledge translation plan and knowledge translation goals that we often conjure for ourselves as we develop a plan and think about who we're going to talk to, what we're going to say, and what we're going to try and accomplish. So my objectives for this little chat with you are to give you a very quick overview of knowledge translation, how we define it here at SickKids, why it matters, remind you of the KT planning steps that I've spoken about in this forum before, and then focus in on evaluating your KT plan. So making knowledge translation useful requires planning. I think we have all been in a situation where we've conducted a project or we've done some research and had in mind somewhat in the back of our heads that we were going to share this research knowledge that we accumulated, but we weren't too clear on what that was going to look like. And of course, as academics, the go-to sharing mechanism is a peer-reviewed paper, and that's well and good, or a conference presentation, sometimes a more informal presentation or dialogue. And we do these sorts of activities as par for the course, where it's ingrained in us, this is what we do. What's a little less easy to sort of wrap our heads around is to step outside of that world, that academic world, and think about who else in our environment or neighboring environments might be interested in the work that we're doing, what we've discovered, and who might we invite into our knowledge user or target audience family, if you will, in terms of thinking through who do we want to talk to. And to do this, it requires a little bit of planning. So planning with anything that we do, I think, is useful. It actually means that you have a higher chance of actually conducting the activity that you have in mind. And at least in a Canadian context, we have several drivers for knowledge translation activities and knowledge translation planning. It's oftentimes requested in a funding opportunity as a component or a section of a research proposal. We have a common CV framework for our federal health and funders and other types of funders that often asks us to talk about the knowledge translation activities we've done. And importantly, I think a key driver is at the end of our research, when we have to report back to our funders, there's a large section of report back that has to do with knowledge translation, asking the investigators to not just report on the activities that they engaged in to transfer knowledge, but what the impact of those activities were. So knowing that at the front end of your research endeavor is obviously a good place to be. And these are important drivers for us here. So the other thing is that, you know, the kind of things that we typically do, we write papers, we talk to people, we go to conferences, are all targeted at other scientists or people who are well tuned into the academic literature, can access the academic literature, and oftentimes we want to reach a broader group of knowledge users. And let me just, as a caveat say, this is not only a concern of people who are doing research in community health or sort of the more traditional clinical or health service or population health pillars of research. It's also important for basic scientists, because if you think about who they might want to engage, although it might be a different list of knowledge users than it might be, say, for someone like myself who's a health system researcher, they might want to talk to other researchers on the periphery of their area. They may want to talk to clinicians, to industry. They may have a commercialization target in mind. And so they also have a broader knowledge user or target audience group to consider. Now, sadly, we spend so much effort writing our papers and trying to get them published. It's kind of sad to see how many people actually read them in the end. And so, even if we were only targeting our research efforts to academics or to people who can access the journals, we find that that's not necessarily the most engaged manner to target our main messages, and that we often will need to supplement our research papers with other activities. Most of the time, things sit unread in journals. The same thing happens to our reports, and I think this is a common experience for many people. We're also being encouraged to be somewhat more accountable for the use of public funds. So funders want to demonstrate a return on investment. Oftentimes, a key driver would be academic promotion, perhaps if you're going forward for promotion. As is the case in our own Faculty of Medicine here at the University of Toronto, we can go forward on teaching, research, or creative professional activity. And this latter category captures the community-engaged scholarship and the knowledge translation activities that many of us engage in. But we are being asked to do more than just say what we did. We're being asked to demonstrate the impacts of the activities in which we engaged, or the novel scholarly contributions that we contributed to. And that takes a little bit more effort, and so a KT plan comes into use there. As I just said, we're increasingly being required to demonstrate the impact of our research. That might be at an organizational level, a funder level, or even your community partners. And lastly, we want to advance the science and practice of knowledge translation. There's a real opportunity here that I think is unmet in terms of sharing with one another as a larger community the sorts of knowledge translation activities we do and their effectiveness. And, there really isn't a forum in which to do that outside of the sort of rigid academic journal forum. And so I think that's something to explore, but there really is an opportunity here to advance our knowledge base. And simply, if we don't plan for it, it's just not going to happen. So for us, knowledge translation, we use the term very broadly to capture the set of activities and processes in which we engage to ensure that people can access the research, that they can understand the research the first time, and that they can benefit from the research, whatever that benefit may be. And it's important to distinguish the term knowledge translation in the manner in which I'm using it as this sort of umbrella term from the term implementation. And they're often used synonymously, but I think there's some complication there. So for us, implementation means your KT goal is to change what people are doing, or to inform practice change, behavior change, or policy. I'm using the term knowledge translation as simply the activities and the strategies we use initially in any instance to get people to understand the research evidence and start them on a pathway of benefiting from that knowledge. So knowledge translation activities are all guided by a KT goal. And these KT goals can be anything from generating awareness and interest. If you step back and think about what you do when you give a talk or you write a paper, what you're doing is not based on a synthesis of evidence. You're simply saying to a group of people who access in this preferred manner, you're saying, this is what we did, this is why we did it, this is how we did it, and this is what we learned, and possibly these are the implications. So there are a lot of instances where, regardless of where else we want to go with the knowledge sharing, at a basic minimum, we're generating awareness and interest, we're sharing knowledge, we're probably informing research, and then we may want to do things like inform decision making or facilitate practice change or policy change or behavior change in the public or community. We might want to take our work down a tech transfer or commercialization pathway, in which case that would be a whole other set of procedures and strategies. And so the boxes that you can see on the second and third row that I've added sort of a tick box to are the ones where I believe the subspecialty of implementation science starts to come into play. And so this helps you think about knowledge translation, where does implementation science fit, and then within that, where does commercialization and tech transfer fit. So some of the common pitfalls of knowledge translation that we see, as many of you probably have experienced, I've reviewed a lot of research proposals in my career, as well as knowledge translation plans. And I think early days of how we approached our research conceptually looked like what you see here. We were hoping basic research would inform clinical research, which would then inform practice. And as you have all seen probably too many times than you can count, this, it takes on average 17 years or so for this journey to actually occur, and it's not always entirely effective. It's a bit haphazard, hit and miss, and so that's something we need to think about. An improvement upon this is to think of a conceptualization where we have this KT activity that happens to get to practice. And by practice, I really mean to get to some kind of benefit. And so we're inserting ourselves here with a set of skills and competencies that traditionally researchers or even project folks out in community organizations haven't really strengthened yet. To take that even further, we might want to, if we're intending, if we have as a goal to change what people are doing, insert a special implementation component to that knowledge translation strategy. One of the things I often see in terms of people's proposals and where things fall apart is in the alignment of a proposal. So oftentimes you will see someone writing something about their KT plan that says something about who they're involving. So they'll identify target audiences and people who are on their team, different organizations or partnerships that they have organized. And then they'll go to a second paragraph where they talk about the strategies or the KT or even implementation strategies that they're going to use. And the problem with that is that they're disconnected. On the one hand, you've told a story that says, here's who's involved, and then here's what we're going to do. You may not have included there even what you think the main messages are, but certainly what's missing is the knowledge translation strategies serve what purpose? When we communicate with anyone, any type of communication, we have a purpose for that communication. And the KT goal serves as the purpose of your knowledge translation. What we need to see is something more like this. So what did you learn? Who needs to know? And in who needs to know, you're identifying 1, 2, 3, hopefully not more than that, knowledge user groups or target audiences. And then you're tailoring that main message to each of those knowledge user audiences. And you're thinking through, why am I telling them this? How do I envision that they may benefit? So thinking back to the earlier slide of the KT goals, this is where you're getting an idea of, well, I want parents to benefit in this way. I want researchers to benefit in this way. I want community organizations to benefit in this way. And you define a knowledge translation goal that maps to that knowledge user audience. And then you think about, okay, now how do I get to accomplishing this goal? If my goal is to develop awareness, what KT strategies might I use that will accomplish that? And then further on, how are you going to know if you were successful? How will I know that doing, for example, a set of webinars for community organizations on how to engage people with disabilities or how to what to consider in employment of people with disabilities. If it's about building awareness towards practice change, how am I going to show that that webinar actually accomplished this? And that's the kind of alignment we're talking about. One of the things we're developing here at SickKids as part of a knowledge translation professional certificate that we run is a rubric for determining the quality of a KT plan. It's one of the criteria that our participants have at the end of a long and grueling week of knowledge translation learning, that they have to present their KT plan, and we listen very attentively, and we use a rubric to help us listen actively, but also get a sense of comprehensiveness, alignment, and feasibility of the plan. And so alignment means looking at things like, is there alignment between the KT goals and each knowledge user audience? Are they describing the intended benefit for that, for those activities? Is there alignment between the goals, the audience, and the strategies? Is there alignment between the goals, the audience, the strategies, and the metrics? And then do people identify the potential impacts they hope to get? So when we talk about knowledge users, we're talking about things like who needs to hear your message. And it's funny, so much of what we lay out in sort of what we think are the best sort of evidence-informed methods for knowledge translation planning and knowledge translation activity seems so simple and not something you really need to do a deep dive in your head about. But it's interesting when you ask researchers, so who are your knowledge users? They'll riff off one or two different groups of people, but then when you start to talk to them about, well, might this have implications for anybody else, they do come up probably with one or two other knowledge user audiences that they had never considered reaching out to. So that's an important exercise to take on with your team. How well do you know them? So how well you know your knowledge users is really informative. For one thing, it tells you something about how you can find the right connection between your research evidence and the sticky, thorny problems that they're dealing with in whatever context or world they're in. How do you make a connection between those two things? It tells you something about how you might create buy-in for their interest and awareness in what you have to say. It tells you something about what their preferences are for where to go get that information and what format that information should be in. We all learn differently. We pay attention to things differently. Some people like, tactile. Some people like auditory. Some people like visual. It's about just, knowing enough that you can take the right knowledge translation approach, craft your message, pick the right strategies, and pick strategies and formats that map onto the preferences of your knowledge users. So for example, work that we've done with teachers, one of the things about 10 years ago, every KT plan had a new website. Everybody was going to develop a website. Well, if you think about the day of a teacher who is sort of bound by a very structured day, they're unionized, their time is monitored very carefully, teachers do not have time in the course of their day to go to a website to search for information. So that may not be your top tier KT strategy. So that's what I mean by know your audience and figure out how well you know them. You also get a sense of how prepared they are to benefit from the information that you want to share. If your research evidence is instrumental, actionable research evidence, it gives you a sense of, well, are they ready to hear it? Are they ready to act upon it? And you don't know that if all you do is passively send them information at the end of your grant experience. It also gives you a sense of sort of what barriers you might have to deal with. And so finding out from your knowledge users at the get-go, what are they dealing with? Why might they be interested in this research? How can we make this research interesting to them or to the people that they're connected with? What formats do they enjoy the most? What's going to have the most traction? Those are all really important questions to ask in the planning phase. Just a little grantsmanship pointer here. When you're identifying your knowledge user audiences, be practical. Be as specific as you can, and don't try and take on more than you can actually handle. It has to do with feasibility. Do you have the available human resources to get the job done? And if you feel like you're going to target 5 different directions, that might be difficult to do. So failing to evaluate whether your KT activities have actually achieved the intended goal leads to, I think, suboptimal knowledge translation. Huge missed opportunity to get some traction, to have some impact, to get some visibility, really, and some proper reach for your research activities. Get it out there, it's the first number one, but get it out there in ways that people will enjoy, people will gravitate to. And so oftentimes we look at sort of how communications folks and social marketers try and attract attention, and we borrow from their toolbox, and that's really useful for us. If you're not getting the impact you need from your research, you're really not realizing a great return on the investment of the research activity. At the end of the day, we like to think, yay, we got funded, we can do this work, and we will do the best job we can, and we'll be so thrilled when it's all over, and we'll think of our paper as a deliverable, and then move on to the next project. I would bet you that your funder, and possibly your research partners, are looking for more of an extension, more value, more return on investment than simply the fact that you're padding your CV. And while it's really good for you to be doing that, you want to be thinking about, how do I really have the optimal sort of traction for the work that I've done and spent 3 or 4 or 5 years doing. And then we also under-realize the potential for how we might contribute to KT Science if we don't talk about our evaluations and what we've learned. So what do we mean by knowledge translation impact? I'm just mindful of the time here, but I know you guys will keep me honest. I think I've got till 4:15 or something like that. So my friend David Phipps has this nice little distinction, because sometimes it gets confused. Knowledge translation impact at the project level gets confused with research impact at a sort of an organizational or even a country level. And there's a lot of excellent work happening in the UK and Australia around developing frameworks and procedures and learning a lot from initiatives that look at the impact of a body of research in an organization. So on the one hand, we have this notion of research impact, which is sort of, how can we demonstrate the contribution that research makes to society or culture or public policy or health services. It's the end game, and we all want to get there and contribute to how well our organizations do or how well our country does in terms of research impact. But what I'm talking about with knowledge translation impact is really the demonstrable contribution that your research or your project makes for a range of knowledge users, appropriate knowledge users, and for a range of KT goals that are specific to your research. So it's the more proximal impact that benefits the researcher and can contribute later on to aggregate impacts of the organization. I was recently, last year in Australia, working with them as they conceptualize a little bit of their research impact assessment framework, and working with organizations that do a lot of research that have really focused their heads on what the country will want them to demonstrate in terms of organizational impact. And I needed to work really hard and mention this many, many times, that whatever you can aggregate at an organizational level needs to stem from the individual KT contributions of projects underlying the organization or within the organization. And so it's something to be mindful of. So when I talk about impact, what I mean is finding indicators, which might be quantitative or might be storytelling, which is hugely powerful, but indicators that tell you or show you that people benefited from the knowledge that you generated and that you shared with them. And that can look in a whole different kind of way. there was recently on Twitter this morning a tweet about an organization that just won the Dance Your PhD competition, describing something to do with mathematics of braids, and phenomenally exciting. I don't think I would have read a paper on it, but it certainly captured my attention for 5 minutes to watch how they represented the work that they were doing. So, there's lots of really innovative ways to share your knowledge, and we need to be thinking as we are creating these innovative ways about how we're going to capture what that does for us. And there are different evaluative approaches that we've used in the past. So what I'm going to take you through are this notion of indicators of reach and usefulness and use and collaboration. You might also have an interest, in addition to or instead of indicators, looking at learning outcomes. So where we're trying to build awareness and share knowledge with people using Kirkpatrick model or different types of model to look at learning behavior results that result from the activities that we do. On the implementation side, there's quite a bit on implementation evaluation, different models that allow you to evaluate the effectiveness of your implementation. But to be clear, what I'm talking about here in this talk is planning for knowledge translation as a general construct. I'm not talking about planning for implementation as a specific type of KT activity. So one of the resources that I strongly recommend, it's helped me think through some evaluation approaches for some of my own KT work, is this one, this guide to monitoring and evaluating health information products and services. And while the language isn't necessarily indicative of KT, it's bang on, and I think really, really useful. And what's useful here for me, in my mind, is how they've sort of thought through what some of the initial outcomes of your activities might be. So things like reach, things like usefulness, things like use, things like collaboration. So let me walk you through some examples of what this looks like. So I saw Marcus speaking earlier, and he was talking about social media, so presumably he talked about analytics and web analytics and the kinds of things that we can pull off of the web, which is our probably increasingly our main mode of distribution or channel of distribution, are things like reach indicators. So, who got this stuff that you put out there, that you translated? And we can think of lots of different ways to capture that. The number of, and whether it's online and it's by hits or reach or downloads, or whether we're distributing things in paper copy or tangible in the real world, we can track things like where did the information go, how is it distributed, how many people wanted it, did they ask for more, how many downloads were there, what sort of coverage or media coverage was generated by the knowledge translation work that you did, and then who's linking to your information, assuming it's online. That's an indicator of value. It's a proxy indicator of value. If people are linking and saying, hey, go here, look at this, there's some suggestion there that this is a valued resource. One of the caveats I want to say here, just around downloads, to be mindful of, while it's a highly accessible metric to have, it only tells you who clicked. It does not tell you what they did with the information once it was in their possession. So if you're like me, I download a lot of stuff and tuck it away in little places of my life, my computer and my desk, in hopes of coming back to it for something that I'm working on. But doesn't mean I've used it right away, doesn't mean I've understood it, doesn't mean I've even shared it with anybody. So we have to be mindful of the limitations of the download. There's also indicators like use indicators. So, when you share information, is there an opportunity to ask people how they intend to use that knowledge? And, you may or may not have a captive audience for long. If you are sharing knowledge in a sort of in vivo real-world context, great opportunity there to get people to jot down for you, how useful was this? What do you intend to do with this information? It sort of aligns with intent to change literature. So that's something to think about. Maybe people have taken what you've shared and they've adapted it in some way. That's an indicator of value. It might be an IP hiccup, but it's still an indicator of did they find this useful enough that they could see how it could be used in their context. Finding out whether they use the knowledge you shared to inform policy or advocacy or to enhance programs or training, education, or research. That might be a direction to go in. Or even whether they are intending to use the knowledge to improve their own practice or performance or life or quality of life in some way. Again, another thing to consider. For many of us, particularly in the sort of more health service research population, health pillars of research, we do a lot of collaboration and capacity building. And up here in Canada, we sometimes refer to this as integrated knowledge translation activities that align with research. But we might think of this in a knowledge translation way and on a planning and evaluation way to think that, well, if collaboration and capacity building is really a knowledge translation activity, how are we going to gauge whether that was actually effective? So whether we are sharing information from the global south to others in the global south, or from global north, sort of developed countries, to majority world countries, wherever that information is flowing globally or even within communities or jurisdictions, that might be important to gauge. And we might want to even track something about our capacity building efforts. One of the tools that I have used in a project, albeit many years ago now, is called the Partnership Evaluation Tool, and I just offer it here as an example. What I like about it is, and there are other partnership evaluation tools out there, that's to be sure, but what I like about it is it gives you a sense of partnership impact through these 4 different sets of activities or domains of activities. The connections that result from the partnership, the learning that results, the actions that are undertaken by the partnership, and the impacts of those actions. And it's really done in sort of a questionnaire format at different time points during the evolution of the partnership. And in the beginning, the questionnaire looks at these questions that are nested in these 4 domains and essentially asks participants to imagine or predict how important it will be for them for that partnership to build their connections, or how important it might be for that partnership to have an impact or to undergo a series of activities or actions together. And then successive questionnaires go back to gauge what actually happened. What was your experience of connection and partnership and learning and so on? And you can graph this to get a sense of where people place their importance, which is the blue line on this spider graph, and what their actual experience is of it. So not only does this give a funder or even a project team a better understanding of how effective their partnership and KT partnership activities were, it also can be used formatively to improve on different areas as you move through the partnership and the partnership matures. So there are plenty of impact and outcome measures out there, and it's, sometimes it just requires sitting down and going through a list and saying, does this work for me? Does this work? Does this work? Does this work? So anything from scans of environment or policy, capturing cultural changes, replication of a knowledge translation activity or product or some sort of adaptation that happens. Can you demonstrate that what you shared in one field cross-fertilized to another field or had an economic impact? Or can you demonstrate that the knowledge translation activities allowed your partners to use research findings better than what they might have done had you not focused in that area. Some of these things we recognize as activities we already do, like event evaluations and satisfaction surveys. But it might surprise you to think of co-authoring of a publication as a knowledge translation indicator of success. If I'm truly trying to be collaborative, it might be interesting to document that my academic and non-academic partners collaborated on peer-reviewed publications or other KT outputs. That's something you can track. The number of activities that you engaged in together. Process measures in terms of events or what happens in meetings or media exposure or process information about communities of learning or communities of practice or interest. Those would be good indicators. And then, of course, technological system indicators figure here as well. Website traffic, resources available, participation and growth in virtual communities of practice. So looking at network analysis, for instance, as a measure of knowledge translation activity of building communities. Increased access to resources. So you can sort of work your way through these lists and sort of have an idea of what it is I'm getting to. Alt metrics are a new sort of family of metrics that have been proposed as an alternative to what I would typically call a productivity metric, which is, your publications, your personal citation indices, and so on. And I make a point when I speak with academics to remind them that a lot of what we track as impact for an academic is actually a productivity indicator rather than an impact indicator. And we can use these alt metrics, which basically cover everything from citation counts to other aspects of impact of work, is sort of in these alt metric Mark would probably say it has this circular thing has a name to it, which escapes me at this point, but gives you an idea of, how much interaction occurred for the knowledge translation activities and outputs that you put out there. So how much you evaluate information that you put out there on the web? One of the research teams that I'm working with is a group led by Pierre Pluy at McGill University. And Pierre has been working with an organization in Quebec that produces and distributes and advocates for good parenting. It's a parenting website, essentially. And together they've been testing the information assessment method, or the IAM. And the IAM is a little electronic survey that sits in the bottom corner of your screen that people who are visiting your website can click on, and that produces or basically activates a questionnaire of a very small number of questions related to whether the reader found the information useful, reliable, engaging, factual, did anything seem glaringly wrong. And so they've been looking at how the IAM is working for website information. And we're going to be using that here for our parent-facing, public-facing website at the Hospital for Sick Children, which is called About Kids Health. So it's just an interesting tool that's out there that gets you thinking about how you might assess the quality and the usefulness of the information that we put on the web, which takes you a little deeper than hits and downloads. Many of you are probably familiar with the knowledge translation planning template that takes you through the various components of sort of a standardized approach to planning a KT plan. And again, I'll reiterate, this is a plan for knowledge translation, not a plan for implementation specifically. See how much time I have here. But essentially, you're identifying your project partners and how engaged they are at different parts of your research or your project, what roles they're going to take on, whether you need expertise on the team relative to knowledge translation and where that might come from. So, for instance, that might spur you to go and find an organizational partner because you don't have KT expertise in your organization, but another partnership organization does. So that might give you a strategic partnership you hadn't thought of before. Who are your knowledge users? So who are you targeting this information to? And, you know, being mindful as you go through this list and identify for yourselves who this information could be useful for, and think about, have you included any of those people on your project team who are going to be a little bit more closely integrated and actually conducting the work from the get-go? What do you think you might learn, and what do you think you might share with those audiences? And then aligning that to, you're going to be sharing this information with what goal in mind. And so you can say, for audience one, which happens to be consumers or the public, we're going to share information about whether our project or our tool was effective. What we want to do in the sharing is to generate interest and awareness, and maybe if the tool is ready for prime time and has good, rigorous, replicated evidence, maybe start them on a pathway to implementing that tool. And then align that again with the KT strategies that you might use to get to that KT goal. And there's a range of them listed here. This is a little bit, column 9 is a bit more grantsmanship and a little bit more Canadian context in terms of thinking through when knowledge translation is actually occurring in your endeavor. But I think it's useful regardless of where you are. If you have an interest in knowledge translation, it's useful to know what's appropriate. Are we integrating this and doing knowledge translation as we conduct the work of this research, or is that not necessarily appropriate or even needed? And what we're going to do rather is just situate our knowledge translation activities at the end of the grant. In this large beige section, column 10 is really about asking yourself about impact and evaluation, beginning with, where do you want to have an impact? Healthcare, practice, policy, research, knowledge, and then how are you going to know that you achieved your KT goal? And this gets us back to the indicators that I listed. On the right-hand side of that column are more sort of general guiding questions for evaluation, because there are often situations where the researchers are not the only stakeholder involved in thinking through what might we measure in our KT activities that could be valuable. You may have other stakeholders who have a different perspective on evaluation. Asking what the other stakeholders value in the evaluation, what they say they need from the evaluation, might be a direction you could go in, and here is a set of guiding questions for that conversation. And then mapping resources, budget items, and column 13 is really the KT methodology. What's your method? What's your procedures for implementing your webinars or your brochures or whatever it is you're developing? How's that actually going to look? I don't expect you to read what's on the slide because it's a lot, but I often get asked, okay, so once you finish that planning and you're writing this up for a proposal, let's say, how do you write it up? And this was just by way of giving you an example of something that I had done for a project. The way I write it up, essentially, is to have a paragraph that talks about the integrated knowledge translation in terms of the who, what, where, what the goal is, what the strategies are, and how are we going to know we were effective in our integrated KT, so this nice alignment. And then for end of grant sorts of things, to lay it out in goals. So the goal might be to develop awareness. How are you going to do that? With whom? So how are we developing awareness with researchers? How are we developing awareness with practitioners? How are we developing awareness with policymakers? And within each of those paragraphs, there's a section there on what we're going to track in terms of impact indicator. So you can download the knowledge translation planning template here on my website. There's also a complimentary game that allows you to use a card deck along the same principles to, have a a manipulable experience with a bunch of cards and your team assembled around a table to start to plan your KT plan. And that's just a different format, really, for getting to the same end. We recently developed 2 e-learning modules. The one on the left is sort of an overview of how we envisage knowledge translation, much the same way I described it at the beginning of this seminar. Really to help people wrap their heads around the fact that when we talk about knowledge translation, it's something broader than simply practice change. The module on the right is a module that we developed to take people through the knowledge translation planning template, because oftentimes you will have heard it, seen it, might even have used it once, and then you step away from it for a period of time and you need to be reminded about how to make it work for you. And so with 5 minutes to spare, which is unusual for me because I usually have way too much information to share, I'm done, Stephen. So it's back over to you and however you want to move forward from here.
Great. Thank you, Melanie. We did have a lot of discussion in the chat surrounding the differences and similarities between communication or communication science and knowledge translation. I thought you might have wanted to give just a perspective from your point of view on what those similarities or differences might be.
That's something that we see a lot of the time in discussion, and in fact, a group of us, some of whom might be on this call, David Phipps, Rosanna Coriandoli at ChemH, David Phipps at University, Michael Johnny, and Gary Myers, we got together a couple of years ago to hash this out because it was a conversation up here. And if I can just frame it a little bit in a Canadian context, even though I know it's a pervasive issue, as the profession of knowledge translation specialists or knowledge brokers or however we label them started to really grow and develop here in a range of different kinds of organizations, what happened was these people started in new roles where there had been long-standing communications departments. So a little bit of friction, a little bit about what's your job, what's my job, so on and so forth. And we had a forum presentation and debate, really, discussion about this. And from that debate that we invited people to, we wrote a paper. And it's published in scholarly research. Oh gosh, you know, when we're on the break, I'll think about what it is and I'll post the link in the chat box so everybody can have it. But we did try to unpack sort of what is communication and what is knowledge translation. So, I mean, top of line things to say about this, there's a great deal of overlap. The whole idea here is for researchers and their teams to borrow from the communications toolbox in terms of modes of communication, channels of communication, style of communication, to help us to become better communicators of our own research evidence. You know, and there are some differences as well. And so we sort of position strategic communication versus knowledge translation. And knowledge translation is communication about research evidence. So whether we want to call that research communication, it's really specific about knowledge translation and, about research evidence, whereas strategic communications can be communication typically about an organization, about something else entirely. So the topical piece is a distinguishing feature. The other is that whilst both communications and knowledge translation have their own evaluation approaches and metrics of evaluation, they're somewhat different. And the reason that they're somewhat different is that the goals of communicating are different. As I've outlined for you, at least 9 different possible knowledge translation goals. Not all of those are communication goals, right? So a communication goal could be change awareness, but it wouldn't necessarily be change behavior as a result of this communication. And so I'm mindful that we're 4:14 and I'm rambling on, but I will find that proper citation and put it out there so people can go and have the paper. It's a debate paper. It's not like we figured it all out and this is what we're saying rules. It's up for conversation. And I guess the last thing I'll say about that is, as we've been training knowledge translation professionals, and we have a panel at the end of that week, many of them have talked about how they have in their own organizations, surmounted and really found some useful strategies for how to work collaboratively with their communications folks and how to make it work for them so that the tensions maybe not disappear but dissipate and they work together. So I'll stop there.
Sure. Thank you very much, Melanie. That was a very thoughtful answer to that discussion. I do want to also mention that, Melanie, you'll be hosting a webcast with the Center on KTDRR titled KT Planning to Implementation to Outcomes. I know Donna will talk a little bit more about this in the upcoming discussion session.